Here's a list of the most commonly tested autosomal dominant diseases. As a review, these are diseases that affect every generation, and an affected patient always has an affected parent. Achondroplasia results from a defect in fibroblast growth factor receptor 3 and occurs more commonly in children born to older fathers. It results in dwarfism, which means the patients have short limbs and a larger head, but their torso is normal-sized. Autosomal dominant polycystic kidney disease, or ADPKD, results in bilateral enlargement of the kidneys, with multiple cysts as you can see in this image. Patients present with flank pain, hematuria, hypertension, and progressive renal failure. Most cases are due to mutation in PKD1, and this is associated with polycystic liver disease, as well as Barry aneurysms and mitral valve prolapse. You can remember that this gene is found in chromosome 16 because there are 16 letters in the words polycystic kidney. Familial adenomatous polyposis is when the colon becomes covered with hundreds or thousands of adenomatous polyps. Do you know what adenomatous means? That refers to a benign epithelial tumor that arises from a gland. This occurs after puberty, which as I mentioned earlier is the case with many autosomal dominant diseases, and they almost always progress to colon cancer by age 40 if they're not resected. Polyps can be seen on this image. The disease is caused by mutation in the APC gene, which is on chromosome 5, which you can remember because there are 5 letters in polyp. Gardner's syndrome, which is described in the GI chapter, is also caused by mutation in the APC gene, but can be distinguished from familial adenomatous polyposis by the presence of osteomas or bony growths on the mandible or skull. Familial hypercholesterolemia results in elevated LDL due to defective or absent LDL receptor. Not having a functional LDL receptor prevents you from removing LDL from the blood, which means you end up with more LDL stuck in the blood. Since it's dominant, heterozygotes are affected, with a prevalence of about 1 in 500 individuals, and they often have a total serum cholesterol over 300. Do you remember what normal cholesterol levels are? That'd be between 140 and 250, although anything over 200 is considered borderline high. Homozygotes are extremely rare, but have a much more severe form of the disease, with cholesterol levels over 700. This can cause severe atherosclerosis, even at early ages, which can result in myocardial infarctions before the age of 20. Patients may also present with tendinous xanthomas, which are deposits of lipids you can see here, although they're most common in the Achilles tendon. Hereditary hemorrhagic telangiectasia is an inherited disorder of blood vessels that result in telangiectasias, which are dilated blood vessels near the surface of the skin. You can see a few in this image of the tongue. This can also cause recurrent epistaxis, or nosebleeds, skin discolorations, and arteriovenous malformations. Do you remember what arteriovenous malformations are? They're abnormal connections between veins and arteries which allow blood to bypass capillaries and go directly from the artery to the vein, and they most commonly occur in the central nervous system. Hereditary spherocytosis results in sphere-shaped erythrocytes due to a defect in spectrin or ankyrin. These are both proteins that maintain the structure and integrity of the plasma membrane. If they're mutated, this prevents the normal biconcave shape of red blood cells from forming, and therefore rather than seeing the normal central pallor, the cells appear uniform. These abnormally shaped red blood cells are destroyed in the spleen, resulting in hemolytic anemia, and it's diagnosed by looking for an increased MCHC on lab tests, which indicates the concentration of hemoglobin in a given volume of erythrocytes. A splenectomy is curative because then the erythrocytes won't be destroyed and won't cause problems. Huntington's disease is a trinucleotide repeat disease caused by a CAG repeat on chromosome 4. You can remember that with the mnemonic hunting for food. The disease only affects patients once they reach a certain age, usually between 20 and 50, and in successive generations it can have an earlier onset and more extreme symptoms. Do you remember what that's called? Right, anticipation. The major findings of Huntington's disease include depression, progressive dementia, choreiform movements, caudate atrophy, and decreased GABA and acetylcholine in the brain. You can remember the caudate, acetylcholine, and GABA phenotypes with letters CAG because that's the trinucleotide repeat that causes the disease. The caudate atrophy can be seen in this image as a lack of gray matter around the ventricles. The choreiform movements are most notorious, and they are often unintentional, non-repetitive, rapid jerky movements. In other words, the patient is unable to maintain a sustained posture. Marfan syndrome is a connective tissue disorder which usually affects the skeleton, heart, and eyes, and results from a defect in the gene fibrillin. Findings include tall stature with long extremities and arachnodactyly, which means long, tapering fingers and toes, pectus excavatum, which is a concave chest, and hyperextensive joints. These patients are more likely to get cystic medial necrosis of the aorta, which can result in aortic incompetence, a floppy mitral valve, and aortic dissection, which is bleeding into the wall of the aorta. They can also have subluxation, which means dislocation of the lens of the eye. Patients with Marfan's are also susceptible to Barry aneurysms. Can you think of a common location of Barry aneurysms? One of the most common is in the circle of Willis. The multiple endocrine neoplasias include type 1, 2A, and 2B. These will be covered in more depth in the endocrine chapter, but for now just know that they are tumors of the endocrine glands such as the pancreas, parathyroid, pituitary, thyroid, and adrenal medulla. Also know that types 2A and 2B are caused by mutations in the RET gene. Neurofibromatosis type 1, also called von Recklinghausen's disease, is a neurocutaneous disorder caused by a defect in the long arm of chromosome 17. Conveniently, there are also 17 letters in von Recklinghausen, which you can use to remember this. Findings in this disease include cafe au lait spots, neural tumors such as optic gliomas, scoliosis, and Lisch nodules, which are pigmented iris hamartomas, which you can see here. Patients with the NF1 are also more likely to get Wilms tumors, which are kidney tumors that typically occur in children. Neurofibromatosis type 2 is due to a defect in the NF2 gene, which is on chromosome 22. Again, it's convenient for memory since there are 2 2s in 22. One of the most common and important findings in these patients is hearing loss, which is caused by bilateral acoustic schwannomas. Acoustic schwannomas are tumors of the myelin surrounding the 8th cranial nerve, which is required for hearing, and you can see an example on this image. These patients also get cataracts at a very young age. Tuberous sclerosis is a neurocutaneous disorder with incomplete penetrance and a variable presentation. It's very rare, occurring in only about 1 in 10,000 people. Findings include facial lesions, called an adenoma sebaceum, hypopigmented ash leaf spots on the skin, cortical and reticular hamartomas, seizures, mental retardation, renal cysts, renal angiomyolipomas, cardiac rhabdomyomas, and a higher incidence of astrocytomas. Now the giveaway question in exams is usually the ash leaf spots, since those are the most specific for tuberous sclerosis. They're a few centimeters long and look like this. The renal angiomyolipomas you can see in this image here, as the radiolucent spots in the kidney. The last autosomal dominant disease I'll cover is von Hippel-Lindau disease. This is also a neurocutaneous disorder and is caused by a deletion of the VHL gene on chromosome 3, which you can remember since there are 3 words in von Hippel-Lindau. VHL normally works as part of the ubiquitin ligase machinery, adding ubiquitin to proteins to target them for degradation in the proteasome. When VHL is deleted or mutated, its targets remain functional. The most important target of this gene is HIF, or hypoxia-inducible factor. As its name suggests, HIF is induced by hypoxia. So what do you think a tissue might do in response to hypoxia? Make new blood vessels to supply oxygen, which is called angiogenesis. Now if this happens in an uncontrolled fashion, which is what happens in von Hippel-Lindau disease, it leads to benign tumors of blood vessels, called hemangioblastomas, which most commonly are found in the retina, cerebellum, and medulla. They can also cause bilateral renal cell carcinomas and other tumors. You can see a cerebellar hemangioblastoma here. Here is a list of the most commonly tested autosomal recessive diseases. As a review, these diseases generally only appear in one generation at a time, since disease alleles are rare, and a patient with the disease always has 2 patients who are at least carriers. Unlike autosomal dominant diseases, death or serious symptoms may occur before puberty. All of these diseases are covered in depth in other places, some in this chapter and some in other chapters such as Hem/Onc. Cystic fibrosis is one of the autosomal recessive disorders and is caused by a defect in the CFTR gene on chromosome 7, which stands for cystic fibrosis transmembrane conductance regulator. The most common mutation of this gene is a mutation of phenylalanine 508, which leads to an improperly folded protein that will be degraded by the cell. CFTR codes for a chloride channel, which actively secretes chloride in the lungs and GI tract and actively reabsorbs chloride from sweat. Since water volutes solute across membranes, the inability to secrete chloride results in thicker mucus plugs in the lungs, pancreas, and liver, which can block pancreatic secretions and permit pulmonary infections, especially by Pseudomonas and Staph aureus. One of the first symptoms to prevent is meconium ileus in newborns, since the meconium is abnormally thick and forms a mechanical obstruction, resulting in abdominal distension and vomiting soon after birth. The majority of meconium ileus is due to cystic fibrosis, so if you see this symptom in your test, think of CF. However, only a minority of patients with CF have meconium ileus, so don't use lack of this symptom to rule out CF. One symptom that can be used to diagnose CF is the high salt content in sweat, which is caused by the inability to reabsorb chloride. How do you think this would affect blood volume? Since this causes salt wasting, and you need salt to maintain blood volume, this can cause hypovolemia. Some other symptoms include infertility in males, since the vas deferens are absent, and fat-soluble vitamin deficiencies, since patients can't absorb them due to the steatorrhea caused by pancreatic insufficiency. On a chest x-ray, you'll often see enlarged bronchi. You should also know that cystic fibrosis is the most common lethal genetic disorder of white people, and patients have an average life expectancy of 36 years. Treatment is supportive only, and one of the most common drugs used is N-acetylcysteine, which can cleave the disulfide bonds in mucus glycoproteins to loosen mucus and allow it to be cleared. Can you think of another unrelated use for N-acetylcysteine? One common use is as an antidote for acetaminophen overdose. Patients with cystic fibrosis can also be given lipases to make up for the lack of pancreatic enzymes in the small intestine. This is a list of the most commonly tested X-linked recessive disorders. Remember, these diseases most commonly affect males who always inherit it from their mother. To remember this list, you can use the mnemonic Be Wise, Fool's Gold Heeds Silly Hope, which stands for Bretton's agammaglobulinemia, Wiskott-Aldrich syndrome, Fabry's disease, G6PD deficiency, ocular albinism, Lesch-Nyhan syndrome, Duchenne's muscular dystrophy, Hunter syndrome, hemophilia, and ornithine transcarbamylase deficiency. Again, these diseases are covered in more depth in other places, but using this list and this mnemonic can help you remember which diseases are X-linked recessive. There are two types of muscular dystrophies, Duchenne's and Becker's. Both are X-linked recessive, and both affect the dystrophin gene. Dystrophin is the longest known human gene, and therefore is the most likely to have spontaneous mutations. The dystrophin protein is cytoplasmic, but is part of a larger multi-protein complex which anchors the cytoskeleton of skeletal and cardiac muscle to the extracellular matrix through the membrane. Duchenne's is the more serious of the two. It often has an onset of less than 5 years of age, and is caused by a frameshift mutation which results in a completely non-functional protein. Without dystrophin, there is muscle breakness which causes weakness, which begins and is strongest in the pelvic girdle muscles and progresses superiorly. These patients also get pseudohypertrophy of calf muscles due to the fibrofatty replacement of muscle tissue there, and cardiomyopathy is common as well. This fatty replacement of muscle tissue can be seen in this image, where the darkly staining areas are muscle fibers and the white areas are adipose cells. Becker's is less severe than Duchenne's and results from a less functional dystrophin protein rather than a non-functional protein. It's not caused by a frameshift mutation, but usually something more mild, like a missense mutation. The onset is a bit later, occurring in adolescence or early adulthood. Gower's maneuver can be used to diagnose muscular dystrophies, especially Duchenne's, since it's more serious. This is trying to stand up from a sitting position without using your arms, and the inability to do this is usually caused by muscular dystrophy. Diagnosis can also be made by looking for increased CPK, or creatine phosphokinase, in serum, or by doing a muscle biopsy to look for fibrofatty replacement, as in this image. Fragile X syndrome occurs in about 1 in 4,000 people and is a trinucleotide repeat disorder of CGG repeats in the FMR1 gene, which stands for Fragile X mental retardation. The product of this gene plays a role in brain development. This trinucleotide expansion results in increased methylation, which decreases expression of this gene and also affects the chromosome structure, giving it a fragile appearance on microscopy. Patients present with macroorchidism, a long face with a large jaw, everted ears, and autism, and are predisposed to have a mitral valve prolapse. This is a list of the most common trinucleotide repeat disorders. You can remember them using the mnemonic "Try hunting for my fried eggs," which represents trinucleotide repeats, Huntington's disease, myotonic dystrophy, Friedreich's ataxia, and Fragile X syndrome. They can be inherited in a variety of ways. For example, Huntington's is autosomal dominant, and Fragile X is X-linked recessive. The number of repeats expands in the female germline, so when these diseases are inherited from a female parent, they exhibit anticipation, which again means the age of onset is earlier or they become more severe in successive generations. You should memorize the actual trinucleotide repeats, since these could help you on the exam. This mnemonic might help you remember at least the middle letter. X, girlfriends, first, aid, helped, ace, my, test. Autosomal trisomies occur when 3 homologous chromosomes are present in a zygote instead of the normal set of 2. This can occur due to a variety of defects during mitosis. Non-disjunction is when chromosomes fail to separate during meiosis, so non-disjunction during meiosis 1 will result in both homologous chromosomes ending up in one gamete, and non-disjunction in meiosis 2 can result in having 2 sister chromatids end up in the same gamete. Chromosomal translocations, which I'll talk about in a couple minutes, can also result in autosomal trisomies. The 3 most common trisomies are trisomy 21, or Down syndrome, trisomy 18, or Edwards syndrome, and trisomy 13, or Patau syndrome. Trisomies of the other chromosomes are not viable. Down syndrome is the most common, with a prevalence of 1 in 700 people, and is the most common cause of mental retardation. Patients often have several classical characteristics, including flat faces, prominent epicanthal folds, which are the folds of skin in the medial aspect of the eyes, and a simian crease, which means there is only one fold in the skin across the palm. They can also have a gap between the first 2 toes, duodenal atresia, and congenital heart disease, and have an increased risk of acute lymphoblastic leukemia and Alzheimer's disease, which they can get at young ages. The most common cause of Down syndrome is meiotic non-disjunction, which becomes increasingly common with advanced maternal age. At the age of 20 or younger, this non-disjunction occurs in only about 1 in 1,500 pregnancies, whereas in women over the age of 45, it increases to about 1 in 25 pregnancies. More rarely, it can also be caused by Robertsonian translocation, which I'll talk about soon, or Down's mosaicism, which is when non-disjunction occurs during embryogenesis, resulting in only some cells having the trisomy. Downs can be diagnosed during pregnancy using ultrasound in the first trimester, in which a fetus with Downs will have increased nuchal translucency and the results of maternal serum tests during the second trimester. This serum test is called a quad screen, since it measures 4 things. If the baby has Downs, alpha-fetoprotein will be decreased, and estriol will be decreased, and beta-HCG and inhibin A will be increased. Edwards syndrome is the next most common trisomy after Downs, with a prevalence of about 1 in 8,000. It's much more severe than Downs, and patients have severe mental retardation, rocker bottom feet, micrognathia, which is a small jaw, and low set ears, clenched hands, a prominent occiput, and congenital heart disease. These babies are usually born live, but they die within 1 year of birth. Similar to Down syndrome, on the quad screen, maternal serum will have decreased alpha-fetoprotein and decreased estriol, but unlike Down syndrome, they'll also have decreased beta-HCG and normal inhibin A. The least common trisomy is Patau's, which only occurs in 1 in 15,000 pregnancies. They have some similar findings as Edwards syndrome, such as mental retardation, rocker bottom feet, and congenital heart disease. However, they also have small eyes and a small head, extra fingers, and a cleft lip or palate, and in some extreme cases, holoprosencephaly, in which the prosencephalon fails to develop into 2 hemispheres, which can cause fusion of bilateral structures such as eyes across the midline. Babies with Patau's usually die soon after birth. For this one, we won't use a quad screen in the second trimester, but in the first trimester you'll see decreased beta-HCG and Papa A, and increased nuchal translucency.